And boom, we're on. We're on. Cliffy joined. Holy smokes, you guys are awesome. Onions joined. Onions, big onions, the biggest onions. What's up, onions? Becca, in a fight, who wins? A bagel or a croissant? Bagel. Bagel by far. I'm from Long Island. If you're like New York City bagels, Long Island bagels. Oh, we kick that croissant out of New York State. We kick it right into the water. Is that even a question, Becca? Come on, Becca. Who do you think wins in a fight, bagel or croissant? Huh? Let's get some answers. Bagel or croissant? I'm gonna tally. I'm gonna tally it up. I only got 10 more minutes, by the way. It's signed on so late today, but I'll record it. I'll put it on the podcast. I'll put it up on YouTube channel. What's up, friends? Dr. M Smiles. Oh, hey, fellow dentist. Oh, hey, Dr. M Smiles. What's going on? Where do you practice? I'm still in residency. I'm a third-year resident. I got a year and a half left. I'll graduate June 2025. Oral maxillofacial surgery training in New York. I can't say more than that. In New York City. I can't say much more than that. Sherman Dixon Jr. How often you eat too many food? I mean, too much food or too many food? Is that a trick question? I eat so much food all the time. Are you kidding me? I just had dinner before I signed on. And then I got to go study at 9. Ken, hey, you're the doctor from the ThatWasEpic. That's me. Yeah, I showed him my apartment. This is my apartment right here. That's that tiny little bed. Look how small that bed is. Look at it. Isn't that cute? Isn't that adorable? This is my kitchen over here. My little kitchen. This is my desk area. And right here, we're on the pod. We're on the podcast. We're on the pod. Yeah, I can't afford to get a bigger bed. More because I can't afford it now. I'd rather save the money, to be completely honest. But this studio apartment is so small, and yes, it's literally $28.90 a month. $28.90 a month. It's ridiculous. But this tiny little studio apartment, if I got a bigger bed, I wouldn't I'd lose half the room. Do you see what I'm saying? I'd rather keep the bed. It's good on my back. I'm not trying to spend $1,000 on a new bed and then I can't even get up in the morning. So Ken, that's my thing. Andre Saffer. Okay, you do a full mouth extraction. Where do you place the new partial? Well, I don't know. A full mouth extraction? Where do you place the new partial? So it would be an old partial at this point, right? Because a partial is made around the existing teeth. So if you're doing a full mouth extraction, it would be a complete denture now. And I'd try and see if we could fit those on some implant-supported denture. Just my thoughts, not medical advice as usual. How do you get rid of dry sockets? So it's a tough question. It's not like you could just get rid of it. You put some iodine ointment in the socket, helps soothe it. You have to replace it like every day. But dry sockets happen on average around day 3. Okay, they happen between days 2 to 4, probably on average day 3, I would say, and they can last up to a week, right? But after that 5 to 7 day window, it's probably not a dry socket at that point. And yes, there are some circumstances where it may keep going, and but on average, these are the average numbers. How do you get rid of it? The best thing you could do is try and prevent it. No smoking, no drinking through straws, no spitting out after you get any teeth extraction, any teeth extracted, things like that. Okay, don't bend down and lift anything too heavy. The reason being is how this works is that the pressure increases in your head, or the pressure decreases inside your mouth. For example, when you drink through a straw, when you're sucking on the straw, it decreases the inside, in your oral cavity, it decreases the pressure in there. And the pressure remains the same inside the extraction socket. In that socket is a blood clot, which is supposed to start the initial phase of healing. That gets dislodged out into the oral cavity because it's a lower pressure environment, right? It pulls it out of the socket. Your body thinks it's still in there, so it doesn't form a new one. And that's how you get a dry socket. Dry socket is called alveolar osteitis. Essentially what it is just exposed bone, and it's very painful. It's one of the most painful things that can happen, and I don't hope that doesn't happen to you, okay? Does that make sense? Hope that explains. Holy smokes, so many comments. You guys are awesome. Oh my God. Road Momad, D4 graduating 4 months. What's your biggest advice for me? Congrats. D4 graduating 4 months. I don't know if you've matched already. Hopefully you match really good, or you're going to start working. Good luck. And my advice for you is find a job that's centered around mentorship more than anything else, not around financials. I know you might have a lot of loans. I understand that. I would center that job around mentorship. the first 3 years out of dental school or residency of practicing, I think translates to the next 30 years. Okay. I'm graduating in a year and a half. I'm already looking for a mentor to work with. Okay. I think that's the biggest thing you can look for. That's my biggest piece of advice for you, Road. Kimmy Dark, can I ask, are water flossers more effective than string floss? No, not necessarily. They're not necessarily more effective. I would use it as an adjunct, personally. Okay, and some people can't use floss. Maybe you're working on a bridge, like a Maryland, like whatever the bridge may be, and you need to use water flossers. Or for example, you're trying to cleanse underneath an implant supported denture that you can't take out because it's fixed in place. Got to use a water pick. You know what I mean? Boring Steve 1000 said, "Can enamel grow back?" No, enamel cannot grow back, unfortunately. That's why I recommend thinking about, if you want to go and get veneers. Remember, you're removing away healthy bone, healthy and not bone, healthy tooth structure, healthy enamel to fit that veneer on there. You're literally taking away healthy tooth structure to slap that veneer on there. It's like a tile on the front surface of your teeth, top, bottom. And look, like, maybe it looks nice, but you're taking away healthy structure. The best thing to do is preventative. Keep your own healthy teeth there. Your own healthy tooth structure. I know all the movie stars are getting them these days, but just my thoughts. Okay, enamel cannot grow back. Enamel is the hardest structure in your body, by the way, harder than bone. Enamel is the hardest thing. It's bacteria that eat away at it, by the way. That's how you lose enamel and get cavities and such. JV, Happy New Year, Ginger King. I guess I'm ginger now. Yeah. Oh my God. My beard is very ginger. It is. And it makes because I have very light transparent eyebrows. I have blonde hair. Maybe you want to call it strawberry blonde. That's fine. But it is blonde hair. But my beard is very red, like very, very Viking. Thanks, pal. Andre Saffer, bagel for sure. Andre, my man. Andre, that's 1 for bagels, and plus, gotta count my vote too. 2 for bagels, 0 for croissant so far. Guys, by the way, if you just came on, we're doing a tally from the first question asked. Who wins in a battle, a bagel versus a croissant? I said bagel. Andre said bagel. Who else? Guys, answer in the chat. Steph Brunsell, how do you feel about prescribing narcotics? I know some DDS OS won't do it. I mean, look, in the literature, it says that you prescribe high-strength Tylenol and a 600 milligram ibuprofen. That's like 200 milligram ibuprofen. I know. It's simple math. I know that's not the point. The point is that over-the-counter is the 200. So if you take 3 of the 200 milligram ibuprofen tablets over-the-counter, you get to that 600 mark. A 600 and an acetaminophen, Tylenol, extra strength. They say that does the same exact thing for a 5 or maybe even 10 milligram Percocet, oxycodone, right? So I try and refrain from prescribing narcotics personally, because that's how you contribute to the endemic of narcotics, right? So, Boring Steve 1000, can enamel grow back? Can enamel grow back? He's like demanding me answer. Putting it in the A2. How do I get rid of dry sockets? Beth Ann Velacris. He reminds me of my son I accidentally ran over and killed in 1988 when I was backing out. Oh my God. Beth. Spencer, current UConn student hoping to extern in the spring, summer. Spencer, what's up, man? Come through. Let's do it. UConn's got a great program too. You got Ian Lynn over there, my buddy from dental school. You got a bunch of my dudes over there. You got bunch of my dudes. Kelsey Grenhell, I think he graduated last year. Is that right? You got Peasy. He externed here. I wish he matched here. Jojo, do you know of the Yankee Dental Conference, and have you ever attended it? Nope, I'm not familiar with the Yankee Dental Conference. Jordan Keshan 875, are you happy with your eyebrows? Am I happy with my eyebrows? Wow. I mean, no, like, it's like they're not even there. I wish I had darker eyebrows, but that's how I was born, I gotta live with it, gotta deal with it, and it's really not the biggest thing. I'd rather have darker eyebrows. Like, they are there if you zoom in really closely. But what are you gonna do, right? What I'm gonna put crayons in my eyebrows? I'm gonna dye my eyebrows? I don't have time for that. What? So B13 Flamingo, what do you think about going in the physician assistant rank? So a couple weeks ago, multiple PAs at the hospital here on the trauma service left. I just put out a post on Instagram. Actually, I put that on TikTok too, by the way. But Instagram, it's taken off. Just today, hit over 100,000 views. But not the point is that a couple PAs left. Apparently, in some places, in some positions, PAs are feeling underappreciated. A lot of work, underpaid. It seems to be a similar concept here, a very common theme here in healthcare. Overworked, underpaid, underappreciated. I don't know. I'm not a hospital administrator. Maybe when I was to be given, $500,000 to be a hospital administrator, I would probably consider it and try and make my dent in the healthcare career to make this a little bit better than it currently is. And hopefully it's a losing battle, but if you can make it a little bit better for a little bit of people, it's a step in the right direction. I think in 5 years, I'd be able to make a big dent in the system and do what's right. DH_778 tips for pre-med, pre-dental. I'm only a first year undergrad at JHU. Johns Hopkins, DH, congrats. Great school. You're in a great spot there. I would just do what you do, focus on school, make sure you're getting shadowing hours in. Obviously good GPA. If you're pre-med, you're going to be taking the MCAT. If you're pre-dental, you're going to be taking the DAT. You'll study for those when you get there. But for now, I would just say focus on studying, okay? I like to use Quizlet. I didn't find that out until dental school. Get a lot of repetitions in. We're all visual learners. You could put diagrams, photos, pictures attached to the cards and get a lot of repetitions in. It'll make you study more effectively, higher scores, and more efficiently. Great scores, studying in less amount of time. It took me a few years, and I got there. You can do it too. Steph, I lost it. Steph, where'd it go? Holy moly. That's a lot of comments. I love you guys. Okay, let's go. E56. I only got a few more minutes. I got to go study. Step Brunsel. Kimmy, Dark, not at all. Lovin' RDH. Hunter Hogue. Just got accepted to dental school. Start in July. Hunter, congrats. Big day. Congrats. You remember this for a long time, forever. And enjoy the rest of your year before you start dental school. Trust me on that. It's going to be a lot. Jeremy, did you know that ThatWasEpic when you did the tour? No, Jeremy, I had no idea. Early on in college, going back like 14 years now, I did see ThatWasEpic videos way back then. Since then, I haven't seen any at all. But then, yeah, he came here. I didn't know it was him until the end, and I was, wait a minute. Jefferson S. Raskin, for full mouth extractions, you recommend waiting before fitting for a PMMA? It really depends. I usually leave that stuff up to the prosthodontist or the general dentist. User 102039. Wait, were you the guy that you're letting your tour apartment and got $100? He actually gave me $2,800. I know the video cut off after like 200 or whatever. No, he paid for the full rent. Yeah, I got the full rent paid. That was awesome. Renee J68. What's up, Renee? I just watched your video about tooth infections and can antibiotics cure that? I am worried. No. Look. And I didn't do that. I didn't put out that video to scare you. It's supposed to be educational, right? I want you to be aware of what you're getting yourself into. Dr. Nicastro just signed on. What's up? Dr. Nicastro's on. Let's go. So, Renee, by the way, hold on, pause. Dr. Nicastro is one of the original dentists. He is the reason I'm in dentistry, right? It was him and another dentist at the gym. Literally, we met at the gym and working out, whatever. Through dental school, I'd see them on the weekends. I would lifeguard at the gym, studying while they were out there in the weight room. And wow, good memories. I do miss the New York Sports Club in Smithtown so much. I'm sure you do too, Dr. Nicastro. Those were the days. I miss those a lot. Residency has been an experience, but so Renee, we would call them the Men in Black. That's one of the cool parts of the story. But because they would dress in all black and they would all drive black trucks and black sunglasses. Anyway. So Renee, So antibiotics can help with tooth infections, right? But The most important thing is prescribing antibiotics in an acute infectious phase, right? Sometimes what happens is you can't always get a patient completely numb because the infection, the bacteria produce acidic products, and the injection material, right? That's lidocaine. That's the Novocaine you get in the injection in the dentist office, and that will the acid and this basic solution in the lidocaine, it's going to neutralize. It's going to turn to water, right? So sometimes, yes, you prescribe antibiotics and you come back in a day or two and then you take that tooth out, right? Or address the source. The source is going to be the tooth. The infection, you might need to do incision and drainage, I&D. You might just want to take that tooth out if you can, if it's indicated. Otherwise, you might be able to save that tooth if the general dentist agrees and get a root canal, okay? Root canal, crown, and so forth there, okay? I would see your general dentist first to see what your options are. And definitely visit a dentist regularly, every 6 months if you can, get your cleanings, get those checkups, get those x-rays when they're indicated, when they suggest getting them. And then you could stay on top of these things so you don't get into surprise, you don't want to get an acute infection like that. Okay. So I wasn't trying to scare you, but you do need to be aware of these things because yes, if they get out of hand in the hospital, these are the ones we get, and it can get pretty bad. We've had several bad ones. The worst we have had was not death. No. But prolonged course, like, especially in patients with like uncontrolled diabetes. Yeah, they can be stuck in the hospital for, we saw, over a month. Anyway, Renee, I had a root canal about 2 months ago, and the tooth is looking blue, grayish in certain lights. Yeah, that can happen. One of my friends has it going on actually right now, and her dentist said might need to be extracted. It sounds like yours is in a good condition. You got the root canal done, but yeah. Jeremy, should you floss one side at a time first? Just go up and down. You could just floss all your teeth. I mean, you could do it however you want. 44 Skywalker, guys. I brush my teeth in the morning and at night. I floss morning and night. I switch with the fluoride mouthwash morning and night. Cavities recalcify. 44 Skywalker. Awesome. Good stuff. Renee, I always have elevated white blood cell count and elevated heart, but have a heart condition. I'm worried. No, I don't want you to get worried. If you're nervous, I would see your dentist soon. Okay. Go see your general dentist and talk to them about it. I wouldn't be too concerned. If you always have an elevated white count, that might be indicative of maybe you take dexamethasone, like a corticosteroid that can cause that. There's a number of things that can be going on. If you have a heart condition, that's probably why you're a little tachycardic. Look, I wouldn't worry about it. Visit your general dentist, get everything worked out. I think it's going to be just fine. Renee, I don't want you to get too worried. Alejandro, is a crown the only option when I get a root canal and it finally cracked? Well, it depends on where the crack is. If it's below the bone, that crack might mean that the tooth is indicated for extractions. If the crack is called like a green stick fracture, that's more for fractures like the mandible. But a green stick or like a haze line fracture, that's when it's just in the outer layers of the tooth. That's not too much to worry about, but something to keep an eye on. And last one, horizontal chip or fracture, that might need a filling or just let it be. If it's down to the dentin, it might get a little sensitive. And if it's a J-shaped fracture, like a vertical fracture that, again, extends below the gum, might be indicated for extraction. When you get a root canal, is crown the only option? Most of the time, it is the only option. If correct me if I'm wrong, Dr. Nicastro, but most of the time, I think, if I remember correctly, this is a general dentist issue. In oral surgery, we don't really deal with crowns ever. But most of the time it's crowns. Sometimes you could get just a filling to fill in the access hole to the root canal. Renee says bagel with cream cheese. All right, that's 3 wins. That's 3 bagels to 0 croissants so far. We got an ongoing. The first comment of the live today was who wins in a battle, bagel versus croissant, and we got 3 bagels so far, 0 croissants. So we're keeping up with that battle. Skywalker depends on where, and it's made New York bagel, France croissant. If it's in France, a croissant, okay, you have a point there. But I think a New York bagel would kick a French croissant any day of the week. Favorite pizza in New York. So 3 years ago, I did become lactose intolerant after a course of doxycycline. Unfortunately, I still do love pizza though. Lactate helps a bit. I think it's Tony's Pizza nearby here in Kips Bay. It was either no, it was Rocky's. Rocky's Pizza nearby here in Kips Bay. Probably the best pizza I've ever had in my life. I had it once, actually for my birthday last year. The best pizza out there. Wow. Good stuff. Some comments on this live were filtered to protect the community. All right, whatever. Ask away. Alejandro, what about after root canal? You're really going to send them home with ibuprofen and Tylenol? Look, this is what the literature says, and most people, their pain is well controlled with ibuprofen and Tylenol. Not everyone needs a narcotic, and if you do, okay, that's fine. We'll work around that. A root canal, I don't know, but after wisdom teeth getting extracted, yeah, I might consider prescribing, like five Percocets or something. Jefferson Raskin, my partner, did AEGD there. Oh, sweet. Devin Michelle followed the live creator. Thanks, Devin. Gober122, do you enjoy being a doctor? At times, yes. At times, well, it gets busy. Gober122, are you in NYC? Yes, I am, Gober. Renee J68 user, that's correct. He was. Jack Blackstock, best qualities for med school application. Good question. I didn't go to med school. I went to dental school. I'm sure it's relatively the same. Someone who's active in undergrad has a good GPA, obviously. For med school, good MCAT score, shadowed a lot of hours, volunteered, and you show that you're active. Maybe you're in the Catholic club or the Indian club, right? The Indian Heritage Club. Maybe you're in the knitting club. Maybe you played sports. I think that's usually good to show that you're active and involved in the undergraduate setting. Seth022, are you OMFS? Yep, OMFS. Luke Predental, what's up, Luke? What's up, buddy? Thoughts on dental/MBA dual programs? It is good. It's a lot of work though. It's it's definitely doable. Several students in my class did the dual program. Now, you do have to understand that right after a full 10-hour day, you're going to have another 1 to 2 hour class lecture that you got to run out of school, get in your car, hop over, and get to the other classroom to do those, when some of the other dental students are just going home and studying. So there are sacrifices to be made. It is very doable. Trust me. It is. But sacrifices nonetheless, right? Classes might be on Friday nights when you can finally get a breath of fresh air. Just some things to consider. Zach, incoming DDS student interested in OMFS. How many hours do you work each week? My first year was up to 120, maybe even more. Second year, I would say 100 was about the average. And now I'm averaging about 80 right now. Sometimes a little more, sometimes a little less. This rotation I'm on SICU, and it's been absolutely outstanding. It's, besides anesthesia, SICU has been my favorite rotation, off-service rotation. SICU is the surgical ICU. Zach, follow the live creator. Thanks, Zach. Sammy Drew 16. Did you finish your residency? I got 1.5 years. June 2025. I finished. Brooklyn, average cost of dental implant when you are. Average implant. Well, at one of the hospitals, it's only $400. At one of the other hospitals, it's covered under their insurance. At another hospital, I'm not sure what it is at the dental school, but generally, implants can range anywhere from $1,500. I've seen as much as $3,500 an implant. That's what I've seen, mostly private practice where I've seen that. NJDDS Junior, me too. Let's go, Dr. Nicastro. Renee J68. Okay, thank you. You got it, Renee. Zach, also, how much sleep are you able to get during OMFS residency? I probably average about, to be honest, 5. I'm getting a little bit more on this rotation. I got very lucky. We are not short-staffed on STICU. Thank God. I got 2 weeks. Oh, no. Just next week, I'm on nights, too. That's going to suck. I'm going to be the only intern overnight. Nonetheless, I probably average right around 5 hours. When I'm on call, I probably average an hour, maybe two, probably 2 hours. I probably average 2 hours when I'm on call. Facial trauma, you might not get any sleep. And yeah, so That's it. Neo, how much sleep do you get during first and second year of residency? First year, probably less than 5. I would probably say less than 5. Second, probably, when I was on general surgery, less than 5. Hand plastics, basically every night was less than 5 hours of sleep. Trauma, maybe 5 hours. Bariatrics, medicine, 5 to 6 hours, I would say. And then MICU's variable because every third day you're on a 24-hour, third or fourth day. Every third day you're on a 24 on hand plastics. And MICU is every fourth day, and you're up all night. You're up all night. You're running. Many patients. MICU is the medical ICU. It's some of the sickest patients in the hospital are there. On that rotation, unfortunately, patients pass away. It's part of life, and it's it's an emotional experience. It's tough. You do your job as a resident, as a doctor in the hospital, but it unfortunately it's it's a lot. It's a lot. MICU is you're running around the hospital, putting in orders, drawing meds, helping out a dozen patients at once that all need your help at once. It's MICU's busy. Colleen OCO, best advice for studying for the NBME style exams in dental school. I would look up materials and resources on Quizlet and just repetitions. Oh, also for the NBDE, NBME style exams. I'm sorry, NBME style exams. No, UWorld. I recommend UWorld for studying for those. And the first aid book, I have it over here. I have it on the shelf over there. I don't know if you can see it, but the first aid is good. Pathoma for pathology, Boards and Beyond, good for pathology. Sketchy Micro for microbiology. Sketchy Pharm for pharmacology. That should cover it. Anna, are you single? Shalot Gotti, thoughts on doing an MS in pharmacology before applying? I've taken the DAT twice so far. I mean, is it necessary? No. It depends on what you want to do. You're in your second gap year currently. Awesome. I hope you're working and studying and getting that DAT up if that's what you need. It depends on what you need. I mean, you got to have the self-awareness and look at your application and say, okay, was it the DAT that I need to do better on? Was it my GPA I got to bring up? What was it, right? And if it was your DAT, I don't know if doing an MS in pharmacology is what's going to bring your GPA up. You see what I'm saying? Figure out what it is on your application as best you can, why you didn't get into, or maybe you're just taking 2 gap years. Fine. Apply and you'll figure it out. Okay? Does that make sense? Renee J. Also, gap years are awesome. I took a gap year. I think it was one of the most influential years to the future of my life. You get a good idea, good sense of where you are in the world, right? When you're stuck in school year after year after year, you are getting institutionalized, right? You just think all you do is you come in, you go home, you study, you take tests, you get good grades, and that's life. That's not life. So I think gap years are crucial for your understanding of what the whole world is and where you fit in it, right? And what you can make out of your spot in that world, He make me free, follow the life creator. Thank you. He make me free. Ayusha Shah, did you take any years after dental school before residency? No, went right into residency. Tony, what do you want to sub-specialize? Absolutely not. No. This is enough specializing for me. I really like oral surgery, oral maxillofacial surgery. I'm not going to do a fellowship. I'm not going to sub-specialize. Rich Dad Poor Dad by Robert Kiyosaki. He says specializing makes you more vulnerable as an employee. And I know a lot of people in the healthcare career, they might not understand that. It's totally right. And Robert Kiyosaki's words are that the more you specialize, you're getting sold on the fact that, you're only going to do what you want to do, what you love to do every single day. But you're more vulnerable an employee in some sense because you're going to get a job. It's probably going to be salary based. Maybe not. You can do a fellowship in cosmetics and stuff and then work in a private practice and do what you need to do there. But if you're working at an institution, at a hospital, an academic center, they're going to try and get you. For the most part, the goal for them is to get you to be salary-based. And then whenever you're off, they can ask you, can you come in? You're only working 4 days a week. Can you come in on your 5th day and work here? You have a fixed salary. It's a chance for them to give more work to doctors and attendings and, when they're getting a fixed payment at the end of the year, right? Very important if you're looking into those types of contracts, make sure that you get bonuses, make sure that when you work overtime, you're getting 1.5 times pay, things along these lines, right? Don't let them fool you. You don't have to be a business major. You just have to have some general sense of careers in general. Does that make sense? You need to protect yourself on all levels. All right, let's keep going. JT, how often do you work with physicians? Every single day. Every single day. In the SICU, I'm the only oral surgery resident on the service, or dentist, if you will. You can call me a dentist, so I'm not going to be offended. Some people are. Sam followed the live creator. Thanks, Sam. Anna shared the live. Thanks, Anna. Luke. What types of gen surgeries do you do in OMFS residency? Okay, so in general surgery, we're on trauma surgery, we're on bariatric surgery, hand and plastics. They kept sticking me on hand stuff, so I didn't do much plastic surgery work, and wasn't in the OR much at all. Mostly just intern work. Did do a lot of bariatric surgery, ironically enough. Did a hernia repair on bariatric surgery month with the Gen Surge team. NICU, medicine, no surgery there. A lot of intubating on the 6 months of anesthesia. What am I missing? Gen Surge. I assisted in the OR a little bit. It's like an X-lap or something. I don't remember. Smiley said, I work in burn. I feel like it's secretly so fun. Mr. Everything. How long is OMFS residency? Either 4 or 6 years. Zach, did you do any research during dental school? I did. I did work with lasers on implants, like bone defects around implants, and laser surgery to try and regrow some attachment in the periodontal, the bone attachment to the implant. Working on bony defects, and essentially the goal was that we were looking at when the laser hits the implant surface, it heats it up, right? When you increase the heat more than 10 degrees Celsius in less than a minute, you're having collagen degradation. You're degrading the proteins around that. So you're actually causing more harm than you are doing good when you're using a laser in that sense. So that's what the research project was on. It was a periodontics project. Dr. Georgios Romanos, shout out to him. One of my favorite attendings in dental school. Live, true. Starting dental school this year, I feel burnt out. I hear you. I do. Schlott Gotti applied the cycle. 1 interview and 1 rejection so far. Nothing post-December yet. Okay. Hang in there. It's still early. Yes, it is. Also working full-time as a DA, dental assistant at an OMFS clinic. Awesome. I did that too. I think it was only 4 days a week at an oral surgeon's office. Great thing to do. Zach, these are the last 3 questions here right now. And then I gotta go. I gotta go study. Zach, 3.4K likes. Wow, you guys are awesome. You guys are incredible. Shlakadi, Zach, also, is it possible for residents to have families, kids, with how much are they're working? Yes. A few residents, that a couple have graduated already. Two residents right now have kids. It's doable. It's very, very, very difficult. It is doable. I don't know if I'd recommend it. I do recommend kids. I want to have a ton of kids myself if I can. Going to be pumping out babies once I graduate. Brandon asked, when did you start studying for the CBSE? Thinking I may start studying later this year. I don't know what year you are, Brandon, but I took the CBSE 3 times. I studied for it twice. I took it once to get an idea what this monster looks like that you're gonna be facing, right? It's a good idea to size it up before you start studying for it. Know exactly what it looks like, because it's different from any test you've taken in dental school. Once after D1 year, after D1 year, no studying for it. Once after second time after D2 year, and I did study 3 months prior to that one, and then once during D3 years, the last time I took it, I studied only 1 month before that time. That's when I got the score I needed. Not the one I wanted. I got the one I needed. Ruben, smile. How old are you, sir? 29. Sometimes I forget. Texas Roddy Mom. Love your TikToks. SICU NP at a level 1 trauma center. Texas Roddy Mom. Oh, if you weren't in Texas, I'd be like, maybe you're here. I work at a level 1 trauma center too. Awesome. And thank you so much, friend. Thank you, Texas Roddy Mom. That's very kind of you. JT, can I see what you are studying? I have it on my laptop. Right now I'm going to be studying. I have Quizlet cards, studying for the OMSITE. It's like a board exam for oral surgery residents. I'm going to be studying that. In fact, if you want to see what I'm studying, actually every day the last 2 or 3 weeks I've been putting up questions of the day. I'm making these questions off of what I'm studying. Like this is, I study it, I learn it, I make a question on it to reinforce it and share the topic with you. So if you want to see those questions, I put them up on my Instagram story. That's at Dr. Gallagher on Instagram. I put up on Students of Dentistry too. Yes, my buddy Sean and I run that page. That's Students of Dentistry. I put it on LinkedIn, and then I also put the explanation. So if you're looking, if you do the questions of the day, guys, if you sign in and do the questions of the day on the story on Instagram, or you see it on LinkedIn, I do the questions with explanations on my podcast in the morning. It's like a 3-4 minute thing. I put a little motivational quote at the end, hopefully fire up and inspire you going into the day. So let me know what you think about that. Luke, any robotic surgeries that you've done in OMFS? No, haven't done any robotic surgeries. Dylan, how soon should a dental student shoot for OMFS if that's what they plan to do? It's a really good idea to always keep your eyes open, right? Don't be narrow-minded going into dental school. Through dental school, you're going to start to go in a direction of a specialty or general dentistry that you love most, right? That you're most fascinated by, and that's good. Go that direction. It's never too early. It's never too late. But if you are in dental school, I would start to look into taking that CBSE sooner than later, like after D1 year. That's when I took it, and without studying for it. After that, start studying for it. Okay, does that make sense, Dylan? I answer that. Insert cool. Nah. Are you getting your MD too? No. I'm not getting my MD. Most respect for MDs. Great things to learn. So much to learn. Great knowledge. However, in oral surgery, it's not needed, especially for the oral surgery I want to do. Not necessary. So I'm not going to do it. It's 2 extra years, and in some programs you have to pay for those extra 2 years because it's MD. You're in med school. That's not something I wanted to do. I want to get out and work. I want to start building a family. I want to settle down a little bit here. I've been running around. Zach, how many classes? Last question. Zach, how many classes do you still take during residency? We take like there was a pharmacology class. It's like a jumble of classes. It's not too. It is serious. I have to go to them all. There's exams and stuff, but it's not like dental school. It's mostly clinical work. It's mostly taking call, clinic, surgeries, OR, running between hospitals and that stuff. All right, guys, that's it. I got to get going. Thanks so much for signing on. I will be posting this on the podcast and YouTube channel. Let me know what you think. What do you want me to talk more about? How I can help you out? Just send me a DM on Instagram. I respond there with audio to give you more detail and responses. Anything I could do to help you out, you let me know, okay? Dr. Nicastro is still on. I love you, Dr. Nicastro. I miss you. Hope you're doing well. My father, my dentist father, right? Father in the dentist route. And he was my mentor. So I come on here now to mentor, educate, motivate a little bit, hopefully make you laugh a little too. And so, Dr. Nicastro, you started this, and hopefully we can make a better future in the profession and maybe even beyond. All right. Good night, friends.